Dr. Diez, tell us, we spoke about missing teeth and how they can really affect the mouth quite a bit by shifting the teeth in front and making it over time. May take years, but nevertheless slowly to make ugly. And like the dimmer switch effect, or like dirty shoes in my case, or long hairs in my case, it just comes very slowly till all of a sudden some people at Starbucks tell you and say, well, you want to lose weight, why don't you cut your hair? And you go, oops, it's time to go. So the point is, it comes probably slow, so you start looking ugly slowly. But also you mentioned headaches, muscle tensions, all that. It's enormously, it's quite amazing. A dentist is not just about fixing teeth; it's about general health, and most of us probably don't realize it. And frankly, I don't think you dentists push it enough. You don't make it. You limit yourself too much. However, that said, what are some of the remedies? What are some of the ways to replace some of those missing teeth we were talking about? Did dentistry have some advances there, like a computer, like everything else?
There are huge advances, especially in the last 10, 15 years with dentistry and how we replace missing teeth. Probably the one that a lot of people talk about these days are implants, and that's where an artificial root is placed into the position where the tooth used to be. Once it heals, you can attach a tooth to it, and basically it's like having a natural tooth all over again. There are still some of the more standard ways of doing it, such as what we call a fixed bridge, which is where you use the adjacent teeth to hold an artificial tooth in place. There have been improvements on how that's done, and it's a much more conservative procedure these days. There's always removable appliances as a last resort, but the key is the teeth should be replaced.
Okay.
The space should not be left.
Okay, tell us a little bit of a difference between, let's just say, the has been around for years and is obviously still very workable, which is the fixed bridge, where you kind of grind down two teeth at the in between a space, put a crown on it, and then hang a third tooth in between, or maybe two or three teeth in between. Tell us a little bit the advantages, disadvantages, maybe even about some slight idea about pricing. Not pricing, but a difference between, let's say, then an implant, and give us the advantages / disadvantages, if there are any, about an implant. It's just in short, big terms.
Okay. When I consult with a patient that, let's say they've lost a single tooth, okay, that's the most common. The biggest advantage of an implant is you don't have to alter or touch the adjacent teeth. And if those teeth are fairly healthy teeth that have never really had large existing restorations, the implant in most cases is the way to go. There are disadvantages of implants, okay? For one, many times the patient has to go without a tooth in that area for quite some time, or wear some type of temporary tooth that can be somewhat awkward. So it depends where that tooth is. Many times, depending on the health of the bone in that area, many times a bridge is ideal. I've talked to and dealt with many patients who don't want to wait or spend time having a space while they're waiting for the implant to heal, because the implant has to be placed and then has to heal for several months.
The implant being, just to make sure we know, the implant being basically a metal rod, a metal screw made out of titanium these days, which is the same material they use for hip replacement and all that stuff, right? But it gets put in, and then basically it needs to integrate with the bone. Like a foundation, you put a cement, it gotta dry, it gotta integrate, then you can build the rest. Is that what you're talking about?
Oh. Exactly.
Okay.
Exactly.
And go ahead.
But in many cases, an implant is the only restoration, permanent type restoration that can be placed. If you lose a tooth and you don't have a tooth on either side of the space, then that's where the implant is just, it's a miracle. because you can replace a tooth permanently, even when you don't have, adjacent teeth to attach to. The implant does allow you to do that.
Let's talk a little bit about the adjacent teeth. If and when they are relatively healthy, and in the past there was no other option, you need to grind them down. And is it true that sometimes when you grind down a healthy tooth, that because of it, he gets kind of a shock, almost like when we were young, we were told by our parents usually not to cut "I love you" into the tree because the tree gets hurt, and it could get hurt. So again, some trees might survive it, some trees might die on it. So sometimes a tooth says, okay, fine, they grinded me a little bit, no big deal. And some teeth say, oops, and they then die. And by doing so, the whole bridge, because it's all hinged on that saying, again is failing, and now you have an even bigger hole there. Is that true, or give us some more?
To a certain extent. The percentage of a fairly healthy tooth that responds that way is usually not more than 1% to 2%. If the nerve does die, typically that's what can happen, because when you grind on a tooth, that's a form of trauma. And trauma can kill the nerve in the tooth. It's a small percentage, but the good news there is that typically that nerve can be removed and the tooth is not lost. So just
you need to do a root canal on a tooth which even though had a crown.
That's correct.
So you need to drill through the crown, go in, more or less same procedure as such, right?
That's right. Yeah, okay. But I think it's important to mention that with some of the new materials today, that grinding on the tooth can be reduced probably at least 50%. So, which again reduces the chances of the nerve inside the tooth dying.
Right.
So, and again, that's just technology.
Good. So basically, I see that, you're not hobby horse riding one procedure over the other one.
No. Every case is different.
Yeah. So in many cases, it's a matter of choice by the patient, and it doesn't really matter. It's almost like a green car or a red car. It doesn't really matter, as long as it doesn't. And in some cases, one is a lot better, and then you obviously, it looks like, have all the tools of explaining why it would be.
That's right.
Type of.
That's right.
So, is there a lifespan which is known for either one of them to a certain degree? I mean, I know the lifespans are just estimates and averages. I hate going by averages because, so you're not part of the best, you're not part of the worst. I mean, where are you? But the point is, it doesn't, so, but just give us some idea, if there is such data out.
All right. Implants, again, they're a relatively new procedure. So, you don't have a lot.
What are we talking about? They've been around 20 years now, right?
I call that relatively new. Okay. I mean, because I have bridges in my practice that were done by dentists older than me that are 30 and 40 years old. So, there's not a lot of implants that are more than 20, 25 years old. They were being done in the 80s, but, very, very few. But what statistics show, patients that have had implants 10, 15, 20 years now, they're still going strong. So there's really no reason to believe, that they can't last 20 plus years. Again, a lot of these 10, 15, 20-year-old implants, they look almost as good as they looked when they were first put in. So lifetime is definitely not out of the question for an implant. On the other hand, bridges. Again, I will tell you, patients that take care of their teeth, they brush and they floss, they do things the way they're supposed to, no different than taking your car in for service every time it's due. I have a lot of bridges in my practice that are 20 plus years old. So a lot of it depends on how the prosthesis, the implant, the bridge is taken care of once it's placed.
Okay. Let's talk a little bit about the taken care of. There obviously is a little bit more problem cleaning, flossing, and brushing a bridge, because
that's a good point.
Can go in between. You have to use those floss threaders. So if you're a guy like me, who is at night, I walk with my wife into the bathroom at the same time. I showered, I flossed, I brushed, I combed my hair, I shaved, and she's still brushing her first 2 teeth. So, so a guy like me could possibly have some problems with a bridge in that case. Explain that a little bit. We have not much time anymore, so need to ask you to be fast.
Okay, that's a very good point. With an implant, you can treat it exactly like a natural tooth. Clean it and everything else just like a natural tooth, and that's wonderful. A bridge, yes, you have to clean it. There's a unique way you have to clean it. It's not difficult, but it has to be done. It takes a little bit more time. So an implant is much easier to maintain. That's a very good point.
Okay, so if someone is a little bit on the lazy side, he might... that might sway him to go to that side simply because, well, it's some things to do. And of course, if you do develop the maintaining will cause periodontal disease, and in another video you have talked about the literally, probably what I call the most devastating effect dentistry can create, and currently the most common effect being periodontal disease, gum disease. And so if that is there, it's a minute-by-minute poisoning of the tooth.
That's right.
So that should be a consideration. Anyway, again, extremely informative. Thank you very much, Dr. Diez. Bye-bye.
Thank you, Helmut. Bye-bye.